All right, everyone, we're back with Physio Fitness Cambridge and CrossFit Rebuild, talking about neck pain or interscapular pain. I'm going to show you a really simple soft tissue mobilization technique today, or like trigger point release therapy. What we're going to use is a lacrosse ball. If this is too intense, you could use a tennis ball. And before you attempt this technique, so this is not for an acute injury. So if you just strained a muscle, you don't want to be digging at it or massaging it. This would be for, neck and interscapular pain that's been going on for months. That is the type of stuff that'll respond well to trigger point release. All right, so we're going to get our lacrosse ball and put it in between our shoulder blade and our spine. So you don't want to put it on the bony prominences in your back. So I'm going to move my arm out of the way and then put the lacrosse ball behind me. I'm going to support that arm. Again, I don't want those muscles to be straining while I'm doing this, okay? So I'm going to support my arm, and you can rest this hand on the opposite shoulder and then hand underneath your elbow. I'm just going to roll around. This should be very hard to find some of those tight spots. Again, just going to go up and down, side to side, until you get right on top of one of those tight spots. And when you find it, you can just put some gentle pressure by leaning into it with as much as you can handle. You can go up and down and just kind of oscillate around it. You want to hang out there for about 1 minute, and then just move the lacrosse ball into a different location. Same thing, I'm going to roll around. And there might be areas where you're not really feeling any discomfort or tension. That's fine. And then we'll just go a little bit lower. Hello, so we found something there, so I'm going to roll around, get right on top of that. Again, direct pressure, and then oscillate up and down, side to side. And remember, when you're doing this, no pain face, all right? So try to smile through it. It's going to feel pretty good. So 1 minute per spot. Try to find about 3 spots. And when you finish, you'll feel kind of a whoosh, like a warm sensation. And that's literally all that blood rushing back to those tissues. That'll help sort of flush away those inflammatory chemicals and some of those pain producers. You should feel release or reduction in pain afterwards. You would want to follow this up by, again, working on that posturing position, or you could put an ice pack on that shoulder right in that same spot, sitting in your supported position, in that thrown position, for 5 to 10 minutes. Just remember, when you're icing, you want to protect the skin so you don't burn yourself. All right? So stay tuned.